Hello everyone, this is Savita working in RPIIT Medical and Technical Campus. Today we will discuss on behavior problems part 2. Thumb sucking and nail biting. Repetitive ritual to cope with stress situation in infants and toddlers reinforced by attention from parents. Predisposing factors are developmental delay and neglect. Most give up by 2 years. If children resumed it at 7 to 8 years, it means the sign of stress. Non-nutritive sucking occur in children up to age of 3 to 4 years of age, but if ignored, children can relinquish it up to age 4 to 5 of age and even more. Can lead to dental problems such as anterior open bite, decreased bone growth, mucosal trauma, altered growth of facial bone, etc. But sometimes in children we can see different abnormalities like speech difficulty, mastication difficulty, digital abnormalities. Nursing management. Rule out cause that could be stress. Remove the stress. Apply some aversive taste substance to thumbnail. Physical barrier like gloves, thumb splints can be used. Reassure the parents that it is transist. Improve the parent attention and nutrition. Teach parents to ignore and give the more attention to positive aspects of the child's behavior. Provide the child praise. Reward for substitutes behavior. Bitter salves, thumb splints, gloves may be used to reduce thumb sucking. Next one is temper tantrum. Temper tantrum is seen between 18 months to 3 years of age due to development of sense of autonomy. Child display defiance or physical aggression, negativism, normal part of child development get reinforced when parents respond to it by punitive anger. Child wrongly learned that temper tantrum are a reasonable response to frustration. Temper tantrum predisposing factors: hunger, fatigue, lack of sleep, innate personality of child, ineffective parental skill, over pampering, dysfunctional family and family violence, and school aversion. Management. During the attack, protect child from an injury, deviating his mind. Tell the parents to be calm, loving, firm, and consistent. Some tantrum are the result of failing to the master the task. In such condition, help to master in simple tasks. Time out. Stranger anxiety. Stranger anxiety seen in between 7 to 6 to 7 month. Stranger anxiety. This may last for few months to peak around 13 to 15 months if infant on approach of stranger behavior with more intense discomfort such as the continuation crying, vomiting, refusal to socialization. It might be indication for later development of behavior problem as separation anxiety. Management. Relaxation technique, slow exposing them to stranger initially from a distance, asking them to greet and slowly advance. Reassure the parents that the behavior gradual decline, but if persist, refer to the child psychiatrist. Thank you.